Hello, and welcome to our assignment, 7 Stages of a Research Interview by Charlotte, Kristen, Christina and Sarah Jane. For SOC A, 321. Research in Complementary Medicine. So our research study topic is Inflammatory Markers in Postmenopausal Breast Cancer Patients, a study of the inflammatory Mediterranean diet in the prevention of tumour progression. The health condition that we will investigate is breast cancer. Postmenopausal women with specific treatment of consuming the anti-inflammatory Mediterranean diet to prevent tumour growth. Justification for this is that the inflammation is one of the leading causes of the tumour progression, so there's a need to explore this. Previous studies have shown that there's positive effects within the Mediterranean diet on the growth of tumours, so it's justifiable to research. So thematizing is the first stage of the research interview, and the purpose of it is to incite the what, why and how of the project. So experts in the field can obtain existing insight of the subject matter that's about to be explored. The why is describe and define the objectives of the research program at hand. And the how is understanding that there are various types of techniques and methods that can be conducted to obtain information of the research topic. So how does this relate to the research study? So the what considers the data and the academic research that's currently available for the information about the tumour inflammation in breast cancer and how this can be reduced through the diet that we're proposing, which is the Mediterranean diet. The why is evaluating the consideration of the anti-inflammatory diet may or may not impact the reducing tumour in breast cancer. And the how is the awareness of the various research methods and approaches that are available to analyse the results. Okay, so designing. So this is the planning and preparation stage to obtain the intended knowledge. The final stage is the research report should be envisioned from the start of the thematizing process. So the overview. So this is to consider the standardised methods of data collection from the start to avoid confusing information later. Interdependence. So this is decisions at various stages can both open and limit what is available for the next stages. Keeping the endpoint in sight. So that's to keep the study's purpose in sight. I remember that the audience that the research is intended for. Pushing forward. So consider what most of the work needed for later stages will benefit from careful planning in the early stages. And getting wiser. Last but not least, be clear right from the start of the study because knowledge gained during the interview could change the course of the intended study. So what to consider for our research in the designing stage. Knowledge gained along the way could change the course of the research, so it's really important to get the design stage on a clear path towards the intended goal. So our research data will include qualitative research. This is baseline examinations such as height, weight, BMI and family health history. The quantitative research will include analysing elevated CRP and leukocyte levels for inflammation amongst the postmenopausal breast cancer patients. So consider a sample guide to the interview for participants and keep the importance of having questionnaires in a format that everyone can understand. So no matter what your language or background, those language barriers are not there, and this is really important. Written consent is also very important, and it needs to be in a format that everyone can understand. So in summary, consider the importance of all 7 stages of the interview during the design stage to keep. The next stage is interviewing the respondent. So using the qualitative interview approach, we'll use semi-structured approach, open-ended questions, and evolving. So what that means is semi-structured. You can answer preset questions, but you're welcome to elaborate. Open-ended questions means that rather than yes or no, it is more based around personal experience and stories, and it's evolving. So the conclusion is flexible and holistic and evolving throughout the research. Next bits of interview questions that we're going to use for our topic. We've got 4 examples. Number 1 is please describe in as much detail if any foods have made you feel better or worse since developing breast cancer. Number 2 is in a typical week, describe the foods that you would usually consume, and do you have any physical symptoms that you've noticed in relation to your eating pattern. Number 3 is elaborating on days or times that your symptoms worsen, and have you noticed if this has anything to do with diet. And number 4 is, do you know exactly what the Mediterranean diet is, and explain what it is, just to clarify that the person's idea of the Mediterranean diet is in fact correct, because that will affect data and how the research plays out later on. So stage 4 is transcribing. So transcribing the qualitative research requires careful observation and listening skills by a trained researcher to record the information, and it helps to gain the understanding of phenomena such as illness and health of the people in the study. So the recordings can be done written or coded or recorded on a tape recorder or a phone. So written form only gives way for interpretation by the researcher, whereas when you record it, you can hear the full the full story behind the person's voice and what they're talking about, and it also gives you something to look back on to make sure that your interpretation is unbiased and neutral. So it would be done for us via recorded tape, as well as the survey and the written answers to the questions. The researcher has to be objective, as explained in the last slide, and it's very important to obtain written consent, making sure that the person understands fully what's written in the consent form. So analysing. So the aim of the conducted interviews is to understand the correlation between the foods of the participants and symptoms which might support the anti-inflammatory Mediterranean diet within the treatment of breast cancer patients. Thematic analysing will be used to explore the transcribed interviews, discover key themes and relationships between the symptoms and the diet. So these are the steps in proceeding with the thematic analysing. So number 1 is familiarisation with the data. Step 2 is assigning the codes to data, and this can be done manually or with a computer program. Step 3 is sorting the codes. And step 4 is reviewing themes, so looking for the major themes within the research and keeping them compartmentalised. Defining the names, defining and naming the actual themes so that it's in an organised fashion that's for everyone to understand. And then last but not least, producing the report, so the results of the report, anything that needs to be looked into in the future, any new information that's come up to justify future research, and whether the results were positive or negative for your hypothesis that you set out originally. So stage 6 is verifying. The use of the thematic analysis will assist in the highlighting relationships found between the patient's diet and inflammation. This can generate generalizability by grouping together similar symptoms and outcomes between the different intervention groups, which may give insight into the potential of the anti-inflammatory diet and the markers on the breast cancer patients. The ability to form the reliable results will be shown when collected data is compared. So the thematic analysis can show the outcomes between behaviours, symptoms, foods, and correlations for the patients. The data collected from the participants' interview will contribute to the overall validity of the study. By using these analyses, you can create themes that show the relationships, and will further assist with assisting the validity of the results. So these are the limitations that we have. Number 1, we've got patient recall. Number 2, there's under or over reporting. Number 3, there's misinterpretation by the researchers or unclear answers from the patients. So that means that the researcher has misinterpreted the information, or the patient may have misinterpreted the question. They're two of the communication problems that could go wrong there. So stage 7 is reporting. The final written report should summarise the data and findings from the interview through either written or an oral report, and it needs to outline the results and what future work needs to be done. To effectively communicate the findings of the report, it must meet scientific criteria in its form, must be ethical and respectful, and appropriate for the intended audience. Sometimes multiple reports are needed if there are multiple audiences. Interesting. This can sometimes include a lot of quotations and paragraphs. To keep it engaging, the author should choose the most relevant quotations and information. So the findings of the study will be easy to read, but also discussed in depth with relationships of intervention groups. The methods will be described in detail, and the questionnaire will be included and the interview results. And this is our references. Thank you for watching.